What's called the pectus, right here, where your breastbone sternum is sunken in a little bit. So
Right,
it's
yeah, you'd mentioned
pressing,
that before.
yeah.
Mm-hmm.
So main thing is this tumor in the right lung that's been getting bigger, and they did biopsy it before and showed sarcoma.
Yeah.
So unfortunately, because of its location, not its size, but its location, we would need to remove that whole lower lobe of the right lung.
Right.
Even at this size, we would have had to do it just because of its location. And so we could do that through 3 small incisions. Biggest one's right here. It's about 1.5 inches long, maybe 2 inches. Above and below would be 2 more incisions that are about 1/2 inch each. And we would take out that lower lobe of the lung,
Okay.
which is roughly half of your right lung, even though it's 1 lobe out of 3. I'm just reminding myself, I didn't see any other significant nodules in that lung. Just that mass. I think you have something small in your left lung.
Yes. That may have to be operated on in a couple
the
months down the
future,
road. Yeah.
Maybe, yeah, I see. So there's this that's a little bit smaller than that, but it's in the lower part of the left lung. And then I think that was it. I don't see any other nodules. Yeah, so that one we have some time for. Oh, actually, there's a tiny thing up near the top that we could just do a little wedge resection. Yeah. So for this one here, I don't think we need to take out the whole lobe. We may have to do what's called a segment, which is 1/4 of the lobe on the left, but we'll have to see
Okay.
how that goes. So we could offer you surgery on this. Right now, unless some other OR date opens up, I can offer you guaranteed November 14th, which is roughly 4 weeks from now.
Okay.
You would plan to be in the hospital roughly 3 to 5 nights, but it depends on how you heal and when we can take the drainage tubes out from your chest.
So is there a possibility of having something open sooner or no?
So yeah, of course, yeah. So our scheduler will keep in touch with you, and if something sooner. But you know, it's taken 9 months to grow to this size from that original size. So even if it grew a little bit more, it wouldn't change the operation.
Right.
But of course,
Eager to have it done sooner versus
the
later.
anxiety, yeah.
Not
So-
run into Thanksgiving and everything else. so-
Understood. So, I mean, potentially we could do you sooner, but then we may be doing your surgery at night.
What difference does that make? You're not awake?
Well, depends on how tired we are from the first 2 right? Last night we were operating till 10:30.
Oh,
last
gosh.
night, right? So,
Really? Huh.
so then you kind of wonder.
Okay.
And not just that, but while you're waiting for the first 2 operations to finish, you're
Right.
not eating anything from midnight before till your surgery
Yeah, okay.
is done. We can do that. I mean, we're doing that now. The reason we're in the OR till 10:30 last night is we had to do the surgery that were canceled by the hurricane.
Oh.
So instead of those patients who've been waiting already
Right.
a month for their operation to wait another month, that would be.
Yeah, no.
But we
Makes
try
sense.
not to do that.
Okay, yeah, no, that doesn't sound advisable.
Yeah, it's not ideal.
Yeah.
So, and November 14th, I know it seems like a long time emotionally, but from a cancer standpoint, it's not going to make a difference. So you do have to come back one more time for the pre-op, but we do the breathing test at that time. I thought I asked Dr. Brohl to order it, but I guess they didn't have a chance to. Yeah. But you haven't had one yet, the breathing test, correct? I couldn't
I
find
don't
one.
think so, no.
What is that? What does a breathing test entail?
So it's 2 parts. One is breathing in and out of a machine that you put your mouth on the mouthpiece, and it measures how well air gets in and out of your lungs. And then so that's mainly the breathing part. And then the second part is you're sitting in a something that looks like a phone booth, sort of, and it measures how well your lung absorbs oxygen and gets rid of carbon dioxide. So, and actually 3 parts, and then they also get a sample from your artery to measure how much oxygen and carbon dioxide are in your blood.
Okay.
So that's the part that most people don't look because it can't hurt a little bit.
Okay.
And then how long does that process take? Like what?
The breathing, the pre-op.
That appointment with the breathing test and.
It's actually multiple appointments, but all in one morning or one afternoon.
Okay.
It can take a couple hours, a few hours, yeah. Because breathing test, you meet with a nurse anesthesiologist, you get blood and urine test, chest X-ray, EKG. Your CAT scan's current, so we don't have to do that. It's really the breathing test that will take the biggest chunk of that.
Okay.
Does that have to be done within a certain time frame?
Within
to the
30 days of the surgery.
So she can do that anytime now since the
Yeah,
surgery
anytime
is.
after Friday.
Okay.
Okay.
Yeah. So I usually request it for the following week, so next week.
Okay.
And then you do have to come back to meet with my nurse, Dana, because she has to do some paperwork with you. And she'll swab your nose, but it's not for COVID, it's for the MRSA bacteria, the staph bacteria that's resistant to antibiotics.
Okay.
So that changes how we give antibiotics.
Okay.
For curiosity, I'm wondering what Moffitt is recommending for COVID boosters for cancer patients.
They're recommending right now the new booster, the new vaccine with the bivalent. You have to do it at least 2 weeks before surgery, so I would get it now. And also the flu shot.
Okay.
My understanding is you can get both at the same time.
I am going to my I have a new primary doctor that I'm meeting with tomorrow.
Yeah.
So I was going to ask her, but we wanted to find out what you said too.
Just get both.
I have had the 2 boosters already. My last booster was in July.
Oh yeah, that should be plenty. I think they just tell you to wait 3 months or something like that.
So
Yeah,
I
so
should get the next one or I should not.
I would get one if you get one, and I would get one. But if you get one, it has to be at least 2 weeks before the surgery. So I would get it now.
Okay.
But but it has to be a certain time after your last booster. I can't remember what that is. I
Okay.
thought it was 3 months.
I'll ask the primary doctor tomorrow.
Yeah. And it's the same if you have COVID. You have to wait 3 months before the booster.
Okay. We did listen to the video that I took when we talked about the surgery, 4 months ago.
Sure.
I think we've got a kind of good handle on it.
Yeah.
All
And
that
did
part.
Dana give you the handout for lobectomies? It talks about a
No.
little bit about the surgery, preparing for it, the recovery in the hospital, recovery at home.
Yeah.
She'll give it to you.
Okay.
So it's not a big incision somewhere.
3 small incisions. But there is a small chance, roughly 2% chance, 2 to 3% chance. We have to make the old-fashioned incision around the tip of the shoulder blade, roughly 6 inches. Although that's not the worst. And in the old days, back in the 90s, we were making an incision from front to back. Yeah. And taking out a whole rib. We took out the whole 5th rib. So what hurt there was trying to suture the 4th and 6th rib together because that's not natural. Right?
Mhm.
Normally there's a rib in between them. And to suture them together, it just makes it feel tight. That's what hurts.
Yeah.
But now we don't cut any rib. We go between the ribs and it's small incisions. So the healing is quicker. The pain is shorter. Usually I tell people expect about a week of pain, maybe 2, but it depends on everyone's pain tolerance.
Mhm.
Some people go home they don't take the pain medication we prescribe. Others, they ask for a refill after a couple of weeks.
Yeah, that won't be me.
Yeah. But average is about a week of pain meds.
Okay.
Will she leave with any drains or anything like that?
We try not to send you home, but it's always possible. So that's what keeps you in the hospital is for us waiting for your lung to heal to remove the drain. And like I said, for this type of operation, around 3 to 5 nights in the hospital, 4 nights average.
Okay.
Yeah, but could be if you're a quick healer, it could be as short as 2 nights. If you're a slow healer, you could be here a week. Kind of depends, but average is about 4 nights.
She's done miraculously well.
Yeah, you look
throughout
great.
the chemo.
You look
so-
great.
Is there anything that she can do to help prep her body to heal better before the
Staying
surgery?
active. Walking is the easiest exercise, right? But 3 or 4 times a day. nutrition, high protein, low sugar. In fact, we'll give you a prescription for a protein supplement that you take the 5 days right before the surgery.
Okay.
And we give you a couple of electrolyte drinks. They're similar to Gatorade, but we call it Clear Fast. We tell you to take one the night before surgery and one just before 5 a.m. before the surgery. And that way, even though we tell you not to eat any solid food after midnight, your body still gets a little sugar, a little electrolytes, you're not, and a little bit of fluid, until the nurses give you an IV to give you IV fluid.
Okay.
Yeah, so those are the main things. Stay strong, stay active. So
How long does the surgery take?
we reserve 4 hours in the OR, but it takes
4
between
hours?
2 and 3 hours.
Wow,
Yeah,
so she's really down and under.
yeah.
What about, I've heard kind of unpleasant things about constipation after surgery due to the anesthesias or anything.
Yeah, and the pain medication. So what we do, one is in the hospital, we give you laxatives and stool softeners. And we also use a pain medication that's not an opioid, so it doesn't constipate you as much. But yeah, the anesthesiologists do give you opioids in the OR and maybe in the recovery room.
Have you had an opioid ever before? Do you know?
It'd be like Dilaudid, oxycodone, codeine, hydrocodone.
Yeah, you had
I'm sure I've
something that
had-
made you sick.
Well, that's what I was gonna
I'm
say,
sure I've
because
had
whatever, I
some.
took something one time and it made me vomit, like.
It
But,
can,
you know,
that's one of the reasons we
I
like
would
to use
take
tramadol,
this,
because
yeah.
it doesn't have
Yeah.
that type of.
Just didn't know if you knew ahead of time.
Yeah.
What
Yeah.
makes you throw up.
Yeah, but if you know that, it should be on your allergy list. I mean, it's because.
Yeah, I don't have any allergies, but I mean, I haven't really had much of that type of thing.
After your back surgery, they gave you oxycodone, I think, before you left,
Did they?
and that you were not feeling well at all.
Oh.
But was it from the oxycodone or was it from the anesthetic?
Hard to say.
Probably from the oxy, we think,
Mm.
because you were okay.
Yeah.
When did you go home after the surgery? The same day?
Same day.
Yeah, so then
It was
you don't know,
outpatient.
because anesthetic can affect you for 24 hours. So if you threw up within the 24 hours.
I didn't throw up though.
No, when you were close.
Or nauseated. I mean, same thing.
Yeah.
Nauseated, throwing
Yeah.
up.
That
All
was
right,
emergency
so you want
surgery.
us to go ahead and schedule you for surgery? I don't think you're scheduled yet. No.
Yeah.